So I'm here with Alexis, and Alexis is a 20-year-old female basketball player, and she hurt her knee while playing basketball. She went up for a rebound, and she came down and twisted her knee clockwise. She said she felt and heard a pop. There was no numbness or tingling. She had no prior lower extremity injuries. So we're just going to do a standard rehab, and we'll get into that now.
Here is a simulated depiction of what the injury might actually look like. As we slow it down, we can see the clockwise rotation of the knee, and we'd expect to hear a pop.
Launch indications are lack of strength, lack of joint range of motion, lack of neuromuscular control, lack of balance, and most importantly, lack of technique. So the first phase we'll be focusing on is the preparatory phase. With this, we're looking at increased strength, increased balance. A couple exercises that will help with that are double leg squats, some steamboats. We could also do core strengthening with planks. Jump roping is always beneficial. So we'll first start by showing a squat, if you don't mind standing up, Alexis. What I'm going to have Alexis do is make sure she keeps her core tight, her feet are shoulder length apart, which is good. Her back's going to be straight, head positioned up, and knees slightly bent. Perfect. And we're going to have to make sure her knees don't go over toe, and she can go ahead and sit down, act like she's sitting down into it. Perfect. Keep her head up, back straight. Go ahead. We're going to do about 8 to 10 of these. What we're looking for is any curvature, unnatural curvature in the back, anything like that, weakness of the core, and we can also improve any of these things. So say we notice weakness of the core, we can add more core strength to the phase.
This exercise is called a plank. It can be used to increase core strength, stability, or balance. Essentially, you can also add different variations to make it more difficult. The athlete's head is actually down, and we have her correct that towards the end, as you can tell. This next exercise is called the bird dog. The athlete is asked to raise one arm and the opposite leg, and it improves stability, core strength, and balance, much like the plank. The athlete's form is a little off. Her head should be up. Oh, look, she fixed it. Perfect. And this is the bird dog. Another exercise you might expect to see in phase 1 is a wall push-up. This is for upper body, but it is involved in phase 1, and here the athlete is just pushing against the wall. The next exercise we might expect to see in phase 1 are squat jumps. Squat jumps are made to focus on strength and power in the quads, hamstrings, glutes, and some of the calves, mainly lower extremity muscles. We'll slow it down here in a second, and we can see that she's bending her knees, exploding, landing with the knees bent, and has great form throughout the whole movement. And this is squat jump.
The next phase is Sub-Maximal, and we're going to focus more on the landing, the technique, the strength, and some flexibility. There's many different exercises we can perform. We can do squat jumps, box jumps, line jumps, which we'll be showing here in a second, A-skips, power skips, anything that focuses on landing or moving from 2 legs to 1 leg. We'll also notice that in the next phase. So go ahead and Alexis, we're going to go horizontal line jump, and just go ahead and get started. And we're focusing on her technique, making sure her feet together, make sure her back straight, her core is good, and that there's no pain in this phase. You can go ahead and stop. We can also make this more challenging by going 1, 2, 3, 4, 1, like that. And then you want to make sure when she's doing this that her form is good, and she goes bilaterally, so she goes the other way too. Backwards. Awesome. And this is for the sub-maximal phase.
The first exercise we'll expand on in phase 2 is an incline push-up, much like the wall push-up, except the body is at a different angle. Her hands are flat against the table, her body is straight, and in this angle we can see her form and how she's doing it properly. And this is incline push-ups. The next exercise is tuck jumps, and we simply ask them to jump and bring their knees to their chest. Here we are doing weighted crunches. You can use a dumbbell, medicine ball, but here we just use a book bag. Alexis is doing a good job keeping her core tight, keeping the weight above her body.
Next phase we're focusing on is maximal. We're focusing more on lower ground contact, so minimal ground contact, higher intensity, and lower reps. Some exercises may be focusing on landing from double leg to single leg, so starting double leg, landing onto your single leg, improving that strength there. skater jumps, we can do tuck jumps, weighted jumps, anything that's adding difficulty to the exercise. So go ahead and Alexis, we're going to do skater jumps, and she's just going to go ahead and get started. So as you can tell, she's landing on one leg. She's keeping her knee bent when she lands. Her core's tight, her back straight. She's making sure she's keeping good balance. And we can do about 8 reps of this will be good. And she's doing a great job keeping good form.
The first exercise we'll look at in phase 3 is a single leg tuck jump. As we get into phase 3, we're increasing difficulty, focusing on single leg landing, and Alana here is doing a good job demonstrating one. She's doing her front leg up, matching her rear leg, and this is the single leg tuck jump. This next exercise is a push-up, but your arm is elevated, preferably on a dumbbell, but we just use clothing here. But she's simply performing push-ups with her one arm elevated. So this last exercise has many different names, but we'll just call it a Russian twist for simplicity reasons. But you're simply doing trunk rotation, keeping your core stabilized, your back straight, and Alexis did a good job of keeping her feet elevated to make it more difficult. And this is called a Russian twist.